Here, a baby or infant is suffering from loss of appetite or insufficiency, and cyanosis in their upper limbs, lower limbs, breathing difficulty during feeding and exercise, everything. And sometimes infant also suffering from breathing difficulty, loss of appetite, weight loss, and pedal edema, breathing difficulty leads to pulmonary congestion and several complications. These things are because of atrial septal defect, which means a septum or shunt present between upper chamber of the heart, between the interatrial. These complications has been assessment has been explained by our students from the Department of Cardiac Technology. Yes, I am a lecturer from the Department of Cardiac Technology. Now we are going to take a demo or seminar classes about atrial septal defect in assessment of echocardiography. Let's see.
Introduction to what ASD is. Atrial septal defect, commonly known as ASD, is a congenital heart disease in which there is an abnormal opening in the interatrial septum, the wall separating the right and the left atrium of the heart. Due to this opening, the oxygenated blood from the left atrium flows into the right atrium, causing mixing of blood and increased workload on the right side of the heart. ASD is one of the most common congenital heart defects seen in both children and adults. Some patients remain asymptomatic during childhood and are diagnosed later in their life during long routine examinations.
Okay, it is congenital heart disease mainly due to it is from birth. So mixing of oxygen and deoxygenated blood, which leads to cyanosis, breathing difficulty, improper organ growth development from the adult, from the pediatric to adult lifehood, which leads to some more life causes problems like pulmonary congestion, sometimes right heart failure, which means left to right side means congestive heart failure, pedal edema, lung failure, and suddenly collapse at all. So we can see about the major causes and diagnostic.
Yeah. So moving on to the causes as to what factors lead to ASD. The exact cause of ASD is not always known, but it mainly occurs due to abnormal development of the fetal heart during the pregnancy. And the common causes and risk factors of this include genetic abnormalities and chromosomal disorders such as Down syndrome, and family history of congenital heart disease, maternal infections during pregnancy, especially rubella, maternal alcohol consumption or smoking, poorly controlled maternal diabetes, and exposure to certain drugs during the pregnancy.
So it is majorly because of maternal infections may be rubella. Because of 110 people may be suffering from these infections, that is rubella. So fetal also may be caused due to ASD, that is abnormal opening in an atrial septum. Let's see their types. What are the types?
Moving on to the types of ASD, which is basically depends on where exactly this opening is found. We have ostium secundum, which is the most common type, and then we have ostium primum ASD, sinus stenosis ASD, and coronary sinus ASD.
So majorly ostium primum, ostium secundum, sinus stenosis, and sinus coronary. Sinus
and coronary
sinus ASD.
Yeah, so moving on to the pathophysiology of this atrial septal defect. Normally, pressure in the left atrium is higher than that of the right atrium. In ASD, blood flows from the left atrium to the right atrium through the septal opening. This is called the left to right shunt, which is seen in this case. And generally, we know that Q is directly proportional to del T, which is basically the flow is directly proportional to the pressure. So, as more blood enters the right atrium and the right ventricle,
that major concept is flow is directly proportional.
Yeah, pressure. So the increase in flow towards the right atrium, the pressure also increases.
That is high pressure flow between high pressure chamber to low pressure.
Yeah, because of the shunt that we saw. And the right side of the heart becomes enlarged due to this, and pulmonary blood flow increases, and over time the pulmonary hypertension may develop. Chronic overload can eventually lead to right-sided heart failure.
So here right-side heart failure is majorly because of this basic concept, that is high pressure chamber blood move towards the low pressure chamber. So high pressure chamber means left-sided heart. That oxygenated blood get mixed with low deoxygenated blood, that is low pressure chamber in right-side heart. So it is get dilated, the pressure get overloaded in both right side also, and there pulmonary artery pressure get increases, and which is again leads to pulmonary congestion and right heart failure.
Okay. Now, if this is left untreated for many years, reversal of this shunt may occur, causing stenosis and
later it will turn to Eisenberg syndrome. That is a flow reversal which leads to a condition called as, if it is untreated, chronic means a flow reversal will occur, so it leads to the condition is called as Eisenberg syndrome. Signs and symptoms.